It's 10 o'clock. This is 7 News.
Tonight, new information about several explosives found in a Longmont home. Then, the small fire that caused a lot of damage in Mesa. Plus, why people in Italy want restaurants to be garlic-free. And a lawsuit to have more people legally sell marijuana in Colorado.
Ann Trujillo, Mike Landis, Lionel Bienvenu, and 24/7 weather with Mike Nelson. 10 minutes of non-stop news starts now.
It is the first lawsuit challenging Colorado's medical marijuana law.
At issue, making marijuana more accessible for people who have certain medical conditions. 7 News reporter Lane Lyon is live at Denver City County building tonight. And Lane, some are complaining that even though it's legal, medicinal marijuana is too hard to get.
And to get medicinal marijuana, you must register with the state, and then many designate a caregiver, someone who's legally allowed to grow it and then provide it to them. But some are arguing that current limits on those caregivers are actually putting lives at risk.
These are the main viral fighters.
Damian Lagoy takes 14 pills a day.
Peripheral neuropathy.
The 47-year-old has HIV/AIDS and hepatitis C. He says all this medication causes extreme nausea, and medicinal marijuana makes the difference. Trouble is, he can't get it. The person he knows who can legally grow it, called a caregiver, can only help 5 people at a time.
Finding another caregiver is not easy. It's just not, you don't open up the yellow pages.
We hear from dozens of people a month that have a problem with this policy.
Attorney and advocate Brian Vicente has filed a lawsuit fighting the 5-patient policy.
It simply restricts patient access to medicine.
A spokesperson for state public health could not comment on pending litigation, but says there are more than 1,300 registered medical marijuana users in Colorado. 56% have designated a caregiver to help administer it.
You have to assign somebody else if you can't grow it or do it yourself.
Damian says without it, he considers not taking his meds, which could cost him his life.
You have friends that could help, but then you're putting them at risk. They go to the black market for you. That's not an option.
Now, the group Sensible Colorado claims that the 5-patient policy is unfair and was illegally crafted behind closed doors. A judge is set to hear the case in the next couple of weeks. Reporting live, Lane Lyon, 7 News.
A Denver AIDS patient who uses marijuana to ease the effects of his medication is suing the Colorado Health Department. Damian Lagoy says the state puts too many restrictions on people who provide the drug. They're only allowed to have 5 patients at a time. Lagoy says when he found someone he finally trusted, he had to find someone else because that person already had their limit. He says that leaves him with very few options.
It's just not feasible to find. The state is not about to turn out a list. You can't exactly open the yellow pages and look it up like you'd look for a doctor or a dentist. And I'm pretty much out of alternatives other than going trying to find it on the street.
Caregivers have to be licensed by the state to properly grow and distribute medical-grade marijuana.